Hi guys, and welcome back to my channel. My name is Sabrina Phillips, and in today's video I'm going to share my story on how I became a mental health nurse and how you can do the same. Just to let you know, on this channel I talk about home styling of my locks. I also give some nursing career advice and budget travel. So if these are some of the things you'd like to hear about, please like, subscribe and ask questions. But without further ado, I will get into this video. So, as you've guessed, and as the title suggests, I am a mental health nurse and I have been qualified for the last 16 years. So what that says is I started my nurse training in 2001, and we're in 2020. 2020 has been a year, but I'm just like fascinated. Like almost 20 years of my life has passed, and it has been an amazing journey. So where did it all start? So I moved to this country in 2001. However, when I did move here, I did really want to become a lawyer, but it soon dawned on me that I wasn't going to be able to afford it because my parents didn't have that kind of money. However, my aunt is a nurse and suggested that I think about doing nurse training. So during the summer, there was this thing called clearing. So I had a look at different universities that were offering clearing spaces and made a couple applications. So to go roll back a bit, to be able to apply for nursing, there are certain qualifications that you do need to have. And in this country, you need to have 5 O levels and 2 A levels, of which it must include math, English, as well as a science subject. So I was quite fortunate that when I moved over here from the Caribbean, I just not too long ago finished my A levels and also had done my GCSEs or O levels back in the Caribbean. So I had the necessary qualification to apply. And also at the time I applied to do a diploma in mental health nursing. However, in 2020 there's no diploma in nursing training available. All nurses start on a degree nursing course. However, there's many different entries into it, but like I said, I'm just talking about my journey back in 2001. And if you're interested in the different pathways into nursing that's available now, I can do a video around that, so do let me know. So I made my application, but before doing that you have to decide which area of nursing you want to go into, and there are currently 4 areas. So they are child nursing, adult nursing, learning disability, as well as mental health. And when I was given those 4 choices, the choice that seemed to sing with what I wanted to do was mental health. And as I said at the start, I did have dreams of becoming a lawyer, and as I found out more about mental health nursing, I saw that it chimed with me. But also for me it was intriguing because where I come from, we've got one mental health hospital that is called, back then it's called the Red Roof. Things might have moved on now, and I didn't know a lot about the area, but what I heard I liked. So there was stuff around advocating for patients. There was also a bit of having to learn about the Mental Health Act law. More recently we've got to learn about mental capacity law, but there was also something about using yourself as a mental health nurse to work with our clients, service users, patients, wherever you are, and what the different names that our people that we work with go by. And for me, that really rang, it touched something in me that I thought, yeah, this is something that I really can do, I want to do, and I'm interested in it. So I did the application. Luckily I was offered an interview, so went to the interview, and part of the interview, back then you had to do a written piece of work. So there was a math test, if I remember correctly. And yes, you do need to know about math because in nursing we are able to administer medication to our service users or patients, and you have to be able to do that accurately because making a mistake in that area can be quite devastating. So yeah, so there is a bit of math in it, that you have to do, but it's nothing to worry about. So don't let that, push you off. So I remember being a student and math wasn't one of my favorite subjects for some reason, but I'm here so you can do it. So don't let that turn you off. So if you're a young person thinking about the subjects you should choose and the things that you want to excel in, especially if you want to become a mental health nurse, just pay attention to those three. But like I said, currently there's different ways into nursing, and I can do a video about that at another time. So got my interview and then started training in September. Yeah, went straight in. And nurse training then and now is a 3-year course. So you spend 3 years learning the craft. However, I must say, more recently, there are accelerated 2-year courses for people that have a first degree in a different area as well. So people that are looking at this that are thinking, oh, I need a second career, I've got a degree in X, Y, and Z, there is an accelerated route where you can do a 2-year nurse training program. So whichever one you do, the different forms that are coming up now, or the 2 or 3-year course, what you find is there's a mixture of what we call placement and coursework of being in uni. And I guess you might have heard, as a nurse, you're always working 24/7, and that's what the course gets you prepared to do. Because when I did my training, we had half time in uni and half time in placements. And basically, when you're in uni, that's where you learn the theory of nursing, so the different skills, knowledge that you need to have. And when you go on to placement, that's where you learn the hands-on bit of nursing, or what we call the practice. So how you actually do, how taking blood pressures, for example. If you're maybe an adult nurse, you might be taking blood, speaking to patients. So you're working alongside other nurse colleagues, other student nurses, doctors, occupational therapists, healthcare assistants, a myriad of different professions that work, whether it's your placement might be in a hospital setting, it might be in a care home, I remember going to a placement in a school because that was the part what I did for my child's part of my training. So you go to various areas, you meet new people, and what it teaches you is how to work in a team, but using your nursing skills, and you get a varied experience. So I had placements, as I mentioned. There's a foundation year that we used to do back in the day when I trained, and you got a different taste of each setting. So as I mentioned, the 4 different areas. So I worked, I actually went to a school because that was the bit where I learned about child nursing. I also went to a home where they had service users that had learning disabilities, and I also worked on an elderly adult ward as part of my adult placement. And then in my second and third year, that's when I really moved into working purely on psychiatric wards or in the community teams, or went to different areas to learn about how a mental health nurse works in those settings. So that took 3 years. And also at that time we did have a bursary, but I also did work part-time in a nursing home, and I think that really helped me because it helped me to hone the skills and the knowledge I was learning in school, and I was able to hopefully give better care to my service users as well. So I really enjoyed that. The other thing is, in my second year, so coming to the end of my training, I remember starting looking around for jobs. So in my second year, that's when I looked for where I wanted to work come the end of my training. And I remember seeing this job, which was a 2-year rotation program, that again just sang to me, and I was like, that is the job I'm going to do. So for me, it was like speaking truth to power, because I, named it, put it out there to the universe. And in my third year, just coming before the end of it, that job came up again, so I applied for it. Luckily got an interview, got lost, that's another story, but was successful and got that job. So what that meant is that, I then finished my nurse training and was able to start work. So we graduated, I think, in August, September, and I started work in October 24th 2004. I don't forget that. I don't forget that date at all, you know. So I went straight from being a nurse and having a job, and it's a lot easier these days because the trust I work with, um, there for nurses that are being trained by the trust, they're automatically offered a job at the end of their placement, so you're guaranteed a role at the end of your training. So like I said, I got my job. At the time, we were in the Whitley system, which was just the grading for nursing at the time. And I remember in that first year, we sort of moved over to what's now the Agenda for Change, where we had banding. So we went from D's and E grades up to different letters of the alphabet, to bandings, where we started at band 5. And one thing I want to say is I remember even before starting my job, I'd already written for myself a 5-year plan. I like plans. I like to look into the future and think of where I want to get to. And, you know, nursing care is sort of like that, isn't it? We're looking at how we can make our patients better, so we're making plans in terms of how we do that. So I just sort of used part of that in planning where I wanted my career to be. And I remember writing down, so as I said, we had the Whitley system saying within 5 years I'm going to go from a D grade to a G or H grade within 5 years. So that meant I'd have to go D, E, F, G, H. So I was thinking of moving every year into a different grade, but those of us that have been in nursing knows it doesn't happen that way. It can, but it doesn't happen that way. But I think, as I said, having a plan and something to aim for helped me to always be thinking freshly what I want to do next and doing the best in each job so I could get to the next space. But I'm happy to talk about that in a different video. So what I want to say, fast forward 16 years, here I am. I'm now an interim director, so I'm at band 9, and that's happened in the last 5-6 years as well. So I can, you know, do a video on that. But I must say, becoming a nurse, choosing nursing and pursuing it has been the best decision of my life. And I'm hoping that, having listened to my story of how, you know, I got into nursing, that, you know, if you're thinking of doing it, so if you're a student in your A-levels, O-levels thinking what should I do, I'd say definitely go for it. If you're already in a career and you're thinking, actually I'd like to switch careers, again, definitely go for it, because, you know, you can do it, and there's so many different routes into nursing now that I'll be really happy to speak to you about. And, you know, I think one of the reasons I wanted to do this video is we're in the middle of the pandemic, we're in a second lockdown, people are going to be, you know, it feels a bit shit really, you know. We've all worked really hard to try and get the virus down, but, you know, obviously it is a virus and it works as it works, and we're in a second lockdown. And what we do know from the first lockdown, it had a significant impact on people's mental health. So I just wanted to, you know, think that maybe people might be looking out to think about how you can get into nursing, and I just want to give information and add value. I hope you enjoyed this video, and if you want to learn more about my nursing journey and how you can do similar to me, or, you know, please do like, subscribe, ask questions. I'm happy to go in as much details or not, as best as I can. Where I can't, I'll point you to different resources. I'm hoping to have some other videos up here that you can look at. Might be somewhere here or there, but please do, like I say, thanks for watching. Do like, subscribe. I've put where you can find me on Instagram and Twitter, and I look forward to seeing you in the next one. And I'm going to try and be saying this all the time, but let's be bold and brave together. And thanks again. Bye.